Hi, everybody. Welcome to week 4 of KHS 110. Did you notice if you made any changes to your dietary habits last week? Maybe you thought twice before you put something in your grocery cart or put something in your mouth, or maybe you swapped out and made a substitution. If you did, awesome job. If you didn't, awesome job too. As long as you are thinking more about what's going in your mouth, that's a win-win situation. We are moving on to talking about diseases, prevention, and treatment, still with the physical topic of wellness, physical wellness. However, now shifting into what happens with our bodies as we age, but also what happens with our bodies if we aren't exercising and maybe not eating the best that we can be. What types of things happen inside our bodies? Not every disease that we will cover in this PowerPoint has lifestyle implications to it, but many of them do, or they're at least tied into lifestyle choices. So while some of these diseases might be hereditary or genetic or have some hereditary or genetic components, there is also definitely a lifestyle component that goes into these diseases as well. And if we are wanting to live our best life and be disease-free and healthy, let's think about some of these things. Cardiovascular disease is the #1 cause of death in adults in the United States. Sometimes that can do with genetics or heredity, but oftentimes it does come along with lifestyle factors. Cardiovascular disease actually is an umbrella term for a number of health conditions, including heart disease, heart attack, stroke, heart failure, arrhythmias, and heart valve problems. If you want to do some more research on any of these in particular, you certainly can. However, I'll just touch on a few of them here. Heart disease is where the heart muscle is compromised, either from the hardening of the arteries, the loss of elasticity from the arteries, the heart muscle itself is damaged from lack of oxygen, and slowly but surely that gets worse and worse until you find yourself, unable to recover from things, and heart disease will eventually be lethal. A heart attack is going to be a discrete event that happens in your life. So heart disease can build. We can get clogging in our arteries and need to have bypass surgery and coronary heart disease and things like that come along. But a heart attack itself is going to be, at one point in time, our heart muscle almost seizes or has a heart attack because the heart muscle is dying. It doesn't have enough oxygen. It has an irregular heart rhythm, and heart attacks can lead to cardiac arrest. People can have a heart attack and not know that they've had a heart attack. People can deny that they're having a heart attack, maybe because they don't know the symptoms or they don't want to think that they have a problem with it. People can have more than one heart attack years and decades apart from each other. Heart attacks aren't always fatal, but heart attacks are definitely a sign of things that are yet to come if people don't change some of their lifestyle habits. A stroke is going to be a blood blockage in your brain. And a stroke can cause some irreversible damage, like things like speech and movement and being able to swallow, because that parts of the brain have been affected by either a blood vessel bursting or non-functioning in the brain. Stroke sounds scary. I think it would be very scary to have a stroke. I've never watched anybody in the midst of a stroke. However, I have seen the other end of things when people have suffered a stroke, and especially if they haven't gotten medical attention right away, and they definitely turn into different people. It's very sad. Some risk factors for stroke include high blood pressure, smoking, diabetes, diet, physical inactivity, obesity, high cholesterol. Those are things that are controllable, right? We can control those factors. On the other side, things like age, family history, your race, and your sex are things that are not controllable or inherent risk factors. So while we can't control that we're aging or that we have a family history, we certainly can control things like, am I smoking? What does my diet look like? Am I moving around enough? Where's my cholesterol level? So there are some controllable risk factors when it comes to considering strokes. There are also controllable risk factors when it comes to heart attacks. Heart attacks happen once every 40 seconds in the United States. So since you started watching this PowerPoint, at least 12 people have had a heart attack. Maybe fatal, maybe not. However, heart attacks are happening all the time. Once you've had one heart attack, your risk for a second heart attack is going to go up. And often, heart attacks are called a silent killer because you don't really have any pre-symptoms. Your heart might be operating at a low capacity for weeks or months. You might have blood vessels arteries that are clogged, valves that aren't working, heart muscle is slowly dying, but then all of a sudden that all culminates into a heart attack. Men and women have different symptoms. Some of the signs or the warning signs you can see on the graphic here. The most common is going to be pain or discomfort in the chest, but you might feel lightheaded, nauseous, you might vomit, you might have pain in your neck or your arm or your low back or your shoulder, and shortness of breath. Those are going to be common signs for heart attacks. But you know what? Those signs also can show up in other illnesses as well, right? So that's why it can seem like people are in denial about having a heart attack, or they don't think they're having a heart attack. They think it's indigestion or food poisoning or something like that. So it's important for you to be aware of the heart attack warning signs, and also important for you to be aware of what you can control for being concerned about having a heart attack. It's the same theme from our previous slide: diet, exercise, weight, smoking, and high blood pressure. Young, healthy people can certainly suffer from heart attacks too. Sometimes people have an underlying heart condition that they have no idea about, and they might be out running, and that heart condition decides to show itself. So we don't know unless you're going to go to the hospital every year and get a scan of all your internal organs in your heart, which I don't think people are signing up to do. Heart attacks can be considered a silent killer because you don't know that they're coming. However, you can protect yourself by watching what you eat, exercising, watching your weight, not smoking, and keeping your blood pressure under control. Type 2 diabetes is also considered mostly a lifestyle disease. If somebody is diagnosed with diabetes, that means that their pancreas cannot make insulin. Insulin is something that gets used to balance out glucose in our body so our blood sugar levels stay stable and our body is a safe environment for itself. However, when we lose that ability to produce insulin, or can't produce enough insulin, or can't control blood sugar levels, then people are considered diabetic. So type 1 diabetes is going to be hereditary, somebody whose pancreas does not produce insulin at all. Type 2 diabetes might come along as you age, and usually comes along because of things like, again, poor diet, being overweight. So some symptoms of type 2 diabetes: needing to go to the bathroom often, extreme thirst and hunger, extreme fatigue, blurry vision. If you have cuts and bruises that heal slowly, and tingling, numbness, or pain in your hands and feet, those can all be some warning signs for type 2 diabetes. Type 2 diabetes interventions have come a long way. Not everybody needs to shoot themselves with a syringe full of insulin all the time anymore. Now you can take pills, or there's continuous glucose monitoring. So there definitely has been some scientific advancements in the management of type 2 diabetes. But a goal for you should be choosing healthy behaviors in the first place so that you don't have to worry about being diagnosed with diabetes. So I've covered just a few lifestyle diseases, or I don't even want to call them chronic diseases, but diseases that are non-communicable, meaning you don't get it from somebody else, but the disease evolves because of, in part, some lifestyle choices that we make. So diabetes, heart problems, heart attack, high cholesterol, obesity, those are all things that start maybe on a slow train, and that train just keeps rolling if we don't make some changes. So what do we do? The American Heart Association says, here are 7 things, life's simple 7. Yeah, simple, right? Simple 7 things that you can strive to work towards to really lower your risk of those lifestyle diseases. Manage your blood pressure. Control your cholesterol. Reduce your blood sugar. Get active. Eat better. Lose weight, and stop smoking. These should be no-brainers. I don't think this is a surprise to any of you. However, how you do those things might look different for everybody, right? So telling somebody you need to lose weight, you need to reduce your blood sugar, that's not going to be very helpful at all because you haven't given them any steps to do it. You haven't empowered them, and you haven't given them any choices. So while this is a nice, simple thing to look at and strive for with goals, if you are a person who is not very health literate and doesn't know how to lose weight or doesn't know how to eat better, this isn't going to be helpful. So part of the purpose of this class is helping empower you to get that information that you need and make those decisions and choices. Let's take a look at the simple 7, managing our blood pressure. There is no cure for high blood pressure. Yes, there's a pill you can take, but that's not going to cure it. You still have to take the pill for the rest of your life or until your blood pressure drops. So you want to focus on lifestyle changes. Some of those changes might include lowering your salt, lowering your alcohol intake, and then taking your medication if it's been prescribed for you. A normal blood pressure for adults is going to be less than 120 over 80. So your systolic pressure is the amount of pressure that the blood flow is putting on your blood vessels when that blood gets pushed out from the heart. So think about it like a rubber band. Or like a straw, you're trying to fit something through that straw, and the pressure that you have to push to blow through that straw, that's your systolic pressure. Your diastolic pressure is going to be the amount of elasticity or the amount of pressure that stays on your blood vessels after that blood has traveled through. So your blood vessels are going to expand to allow that blood to travel through, but then they should contract again. So that's going to be a healthy system. But when our arteries and blood vessels get hardened or get deposits of cholesterol or things like that, the body has to work much harder, and our blood vessels take a hit for sure. So get your blood pressure tested if you don't know what it is. If you haven't been to the doctor, there's still at least grocery stores and pharmacies in my area that have the little blood pressure machine where you can sit down and stick your arm in the cuff and it squeezes it really hard and you get your blood pressure tested. Also, all the fire stations, at least in St. Paul, Minnesota, where I am, you can drop into any of the fire departments or the fire stations and they'll do a free blood pressure screening for you. So it's good to know your blood pressure. Blood pressure can also be a silent killer. We're walking around and we have no way to know what our blood pressure is. So that's kind of scary, right? So if you can know what those numbers are by getting it tested, that can help perhaps make some behavior changes for you. How do we control our cholesterol, and what is cholesterol? Cholesterol is a waxy substance. It comes both from our bodies and our food. So our body makes some of its own cholesterol, but the cholesterol that we ingest from especially fatty, high-fat foods can maybe be detrimental. It circulates in the blood. We've got good cholesterol and bad cholesterol, although I hate to give them names when they can't fight back for themselves. But good cholesterol is our HDL or high density lipoproteins, and LDL, low density lipoproteins, is going to be the type of cholesterol that we are wanting less of. So from this graphic, you can see that cholesterol deposits can build up in the blood vessels and make it harder, make it more work for that blood to get around. A goal is total cholesterol below 200. We want to have our HDLs high, above 60, LDLs low, and cholesterol gets high when we have unhealthy eating, smoking, physical inactivity, and excess weight. I personally have high cholesterol. My cholesterol is about 230. So I get it tested every year because, number one, I'm obsessed with my numbers and I want to have everything be in the perfect range. So it really hurts my feelings that my cholesterol is high. However, my HDL is really high. It's like 85. So that gets to actually count as a beneficial risk factor, or it doesn't cancel out necessarily, but it is a protective thing for me. So even though my total cholesterol number is high, my HDL is high. So every doctor that I've seen has said, you know what, Jen, yes, it's not on the optimal chart, but we're not worried because you are physically active, you aren't smoking. Are there things I could cut back on? For sure, I could cut back on some of those dairy products. Remember from last week, I talked about all the fats that come with us, fats and calories that come with us from dairy products. I'm sure my cholesterol would probably drop if I gave up ice cream. However, I'm not at a stage in my life where I'm quite ready to do that yet. But get your cholesterol checked. It gets you a baseline. You at least know where you are to start with. We also want to reduce our blood sugar. Our blood sugar levels rise either because our body can't produce enough insulin or our body can't efficiently use insulin. That's what we're going to see a lot of times with the type 2 diabetics, is that your body produces it, but it's overwhelmed and can't efficiently be used to stabilize those blood sugar levels. So the goal for our blood sugar is less than 100 milligrams per DL. That would be fasting, so that means without eating anything. 100 to 125 is considered pre-diabetic, and then over 126 is considered diabetic. So the last time that I went to get a fasting blood glucose measurement, I was at 84. So that's looking good, even though I eat a lot of candy. I was like, oh, thank goodness. I'm not ready to give up my candy totally, but I am doing other protective things like getting a lot of cardiovascular exercise and strength training exercise, which helps kind of modulate blood sugar levels. And I am not drinking or not consuming, sugary beverages. I am also doing other protective things to help that blood sugar hopefully stay low. So if you have some of these uncontrollable risk factors, like a family history of it, or a certain race or ethnicity, or a history of gestational diabetes, that's when a woman is pregnant and is diagnosed with diabetes through her pregnancy, then you definitely want to be tested for diabetes. However, going in to get your blood sugar tested, you can do that the same time you get your cholesterol tested in just one prick of your finger or blood sample. So you can get a lot of data about yourself from a small lab test. So if you know that you're a person who is consuming a lot of sugar, and perhaps you have some of the symptoms like fatigue or thirst, or your cuts aren't healing, or you feel like you've got big swings in your body, big swings in energy and mood, and your body is struggling to balance out the blood sugar in your bloodstream, not a bad idea to get that blood sugar tested. Another one of the simple 7 was getting active, which to me is very generic. However, it can be a call to action, right? Let's just move a little bit. Maybe you are watching this PowerPoint from the couch, and we are now 17 minutes in. So maybe you want to pause it, get up, walk around the living room a couple of times, drink some water while you're at it, and then come on down and relax again. Trying to be more active in your days. When you build small habits that involve physical activity, those small habits can turn into bigger habits. Do you remember from 2 weeks ago what our weekly recommendation was for physical activity from the American Heart Association? Go ahead, say it out loud. 150 minutes of cardiovascular movement and 2 days of strength training per week. So 150 minutes, so that's 2 hours and 30 minutes, which to me does not seem like a lot. However, I know that can feel like it's overwhelming. So it's all about your perceptions, right? And then 2 days of strength training exercises, which could be body weight, it could be weight room, it could be circuit training, it could be yoga. You are getting a lot of body weight strength when you are holding yourself up on one leg. So getting active, exercising is going to help ward off some of those lifestyle diseases. Eating better. Again, I feel like this is generic because eating better is up for a lot of interpretations. The way I would approach it is, can you make some small substitutions? Think about the recommendations for healthy eating that we had last week. What does your plate look like? Is half of it filled with vegetables and a quarter of it filled with proteins and a quarter of it filled with grains? And are you getting your calcium intake? Are you doing some smaller portion sizes? Are you substituting whole grains for refined grains? Are you substituting perhaps fruit instead of sweets or baked goods or treats? What are some small substitutions that you can do to eat better? You don't need to have a total overhaul and throw away everything from your cupboards, but are there some substitutions that you can make that will give you more energy and give you more nutrients as well? If you are at a higher risk for some diseases like diabetes, high blood pressure, metabolic syndrome, heart disease, then you might need to take a look at less salt, less fat, less sugar, and fewer calories. I think all of us should be doing that as well. So making some small changes to our dietary habits. Losing weight is another one of the simple sevens, but again, I wouldn't call it simple. I've watched many people struggle to lose weight or not know where to start with losing weight. This is the most prescriptive I'm going to get in this PowerPoint, but I'm not giving somebody an exercise plan. However, for successful and long-term weight loss, it needs to be a combination of an increase in activity and a decrease in calorie consumption. So we got to increase our physical activity, decrease our calorie consumption, but that needs to be in a safe way because otherwise it's not going to be sustainable. From your fad diet assignment, maybe you did the grapefruit diet or the cabbage diet or the soup diet. Those things are not long-term solutions. You will not be able to feel good and maintain optimal health if you cut out huge food groups or cut out huge amounts of calories. On the flip side, you are not going to be able to maintain optimal health if you are exercising 5 hours a day every day. Your body is going to rebel. You're not going to be able to give yourself enough nutrients. Your body's going to get injured. So you need to do this in a safe way. It is a combination of changing food habits and changing exercise. Exercise really doesn't burn a lot of calories. This is very frustrating for personal training clients when I need to tell them that. They're like, well, I went for a half-hour jog. Okay, well, guess what? Half-hour jog is going to burn 400 calories, maybe, if you're running at 7 miles an hour, which is pretty hard for a lot of people to keep up a good clip. So the focus might be on maybe more of the dietary changes, especially portion sizes. I think we just are used to putting stuff on our plate and we scoop and we eat it, or like, oh, there's only 3 left in the box, so I just might as well eat them, right? All of those things add up as the day goes on. So yes, you should definitely be doing physical activity, and that is going to help to create either a negative calorie balance, or it's going to help stabilize your blood sugar levels. It's going to help you sleep better. It's going to help you with more energy. It's going to help you with digestion. There are many benefits of exercise, but burning thousands and thousands of calories is not one of those benefits. So it needs to be a change on both ends of things. As you think about this, can you come up with 2 or 3 suggestions, maybe for yourself or for somebody else in your family, for some small changes that could create a calorie deficit? What would be some small changes, either on the exercise side, the nutrition side, or a combination of both? I know for myself, I eat dessert every night after supper, whether I'm hungry for it or not. My body craves something sweet, and I give into that craving. If I stop doing that even 3 nights a week, that would probably cut down on 600 calories a week for me. Is that huge? No, but you multiply that over the weeks, and that's a much more sustainable change. Or instead of driving to the grocery store, because usually I go a couple of times a week and buy smaller shopping trips, could I bicycle there, or could I walk there? Or instead of getting together with a friend to do happy hour or sit in the backyard, could we play tennis? Could we go on a walking date? Those small changes will help your body to evolve and adapt to new behaviors. And you don't necessarily always realize you're doing it, right? It doesn't have to be drastic. Stop smoking. Again, not simple, but something that is going to drastically cut your risk factors for many types of lifestyle diseases. So why should you quit if you're smoking? Even if you're a social smoker, even if you're vaping, you're going to have a higher risk of developing chronic disorders, emphysema, COPD, heart disease. Again, smoking hardens your arteries. So people who have heart attacks, it's not just because they're eating high cholesterol foods. Smoking is bad news for our blood vessels. You can exercise with less shortness of breath. Wouldn't that feel good to be able to walk around the block without being out of breath? You're going to smell better. You're going to be able to taste things better and smell things better. The stains on your teeth are going to start to fade. So if you're a person who cares about what your teeth look like, that's a bonus. Your blood pressure and your heart rate are going to recover. Smoking ratchets up our blood pressure and our heart rate. Nicotine is a stimulant, so that stimulates the body to go into overdrive. So bringing down that heart rate and blood pressure are going to be good things, as we've already learned. Your carbon monoxide levels in your blood are going to return to normal. So you're actually poisoning yourself. And if anybody who is watching this is a smoker, I know that you know these things, and I'm not saying it to chastise you, but I'm trying to get across all of the negative consequences that will pretty much instantly go away after you've stopped smoking. So let's get that carbon monoxide level back to normal. You'll reduce your risk of developing heart disease by 50%. That's huge. And then risk of cancer is either cut in half or eliminated. So lung cancer, stomach cancer, esophageal cancer, depending on the cancer type, that cancer risk is going to drop a lot too. So quitting smoking is the number one thing that American adults should focus on before any other health behaviors. So if you aren't a smoker, congrats. That is one less thing you need to worry about. But if you are a smoker who has high blood pressure, high cholesterol, and you're overweight and you're diabetic, if you have all of those things and you don't know where to start with the smoking. Smoking is going to be the number one risk factor for so many lifestyle-related diseases. So if you can knock that one out of the park, those other ones are going to come along as well. I can't speak about that enough. The big tobacco industry, just like the food industry, has really gotten creative with marketing, and it's very addicting. So it is not easy to quit, but the benefits of quitting far exceed the pleasure that you get from it, even though it's hard to put those two things in the same category. So what do we do? Heck, I am not interested in dying from heart disease or a stroke or type 2 diabetes or lung cancer. But I can either be preventative or I can be reactive and wait for treatments. Yes, science has come a long way. We have a lot of treatments. We have a lot of ways to keep people alive. We have a lot of ways to give people a second life. However, the United States really seems to take a reactive approach. So instead of reaching out to people where they're at and encouraging them to focus on life's simple 7, right? We say, hey, come on over and I'll give you some cholesterol lowering medication or high blood pressure lowering medication. Or sure, we'll do a quadruple bypass surgery, and then we want you to change your lifestyle, but you probably aren't going to, right? Because behavior change is hard. So in the United States, we're very reactive, and even though science has come a long way, we're not necessarily reaching to the root of some of these lifestyle diseases. You're going to read some articles for this week about the different thoughts between prevention and treatment. If we can modify people's lifestyles on the front end, think about the money that we will save, and the lives that we'll save, and the heartache that we'll save by focusing on the prevention side instead of the treatment side. So if you take anything from this class and the 8 weeks that we've been together, is that commit to taking a proactive approach. That's a proactive approach with your physical health, your exercise, your eating habits, your smoking or drinking or water consumption, whatever that might be. That means a proactive approach psychologically. That means a proactive approach financially, a proactive approach emotionally. I really want you to feel like you are in control and get a say of how you want your life to look. So don't wait, don't be reactive, be preventative so you don't have to worry about things later. Putting that penny in the piggy bank now is going to pay you way more dividends later. Even though it might be a little sacrifice right now, the rewards are going to be multiple fold as you go down the road. So with diseases, just like anything else, prevention is the key. Prevention is the key. All right, everybody, we'll see you next week.